now, and we'll just share my screen and hand over to Geoff and Rebecca.
Okay, so if I start, Geoff, and then
yeah, great.
Yeah.
Thank you.
So thank you for inviting us today. We're here to talk about our Assure platform and our triangulation meeting. I'm Becky Bibby and I'm the Assistant Director at Salford City Council for Early Help and School Readiness, and I've got my colleague with me today.
Hi everybody, I'm Geoff Catterall. I'm Head of Service for Special Educational Needs and Complex Needs in the City Council.
Thanks, Geoff. So next slide, please. So what we're planning to do really today, and myself and Geoff will kind of talk through this together really at certain points, but we just want to give you an overview of what our Assure platform is and how it supports our multidisciplinary team meetings in localities and how it's come about really. And then just obviously the opportunity then for people to ask questions and kind of find out more and that type of thing. So what is Assure? Well, so our Assure is what we call it is it's a web-based dynamic tool, and it was built at the beginning of the pandemic back in March by our developers in the local authority. And initially it was used to support us during that kind of COVID lockdown period, as I said at the beginning of March, and it was about making sure that we had visibility of all our children, young people and families during that kind of lockdown period, particularly for children and families below that threshold, that social care threshold. So we wanted to make sure that we were able to understand and know about how children and families were coping across the whole of the city. So the platform itself is a way that supports information sharing across partners, and it helps us identify levels of need for particular children, young people and families, and what support might be needed during that period of time. And as I said before, the primarily focus of it is for them children and young people and families below that social care threshold. You know, so to really kind of exploit the early help element of it, but also families and children who wouldn't normally be kind of tipping into or accessing any services. So the idea is that partners are able to identify the kind of perceived level of need for that particular child, young person or family, and then they can then escalate and kind of lower that depending on what's going on for that family as circumstances change. And it also allows them for partners and agencies to understand and find out who else is working with a particular child, young person or family, so they can understand what's going on for them, who else is involved, what support's already being accessed by that family, or actually to make a suggestion that they need a further discussion to put a package of support in. So it's a platform that partners can access and they can input and they can use, and then we can look at how we use it then to kind of make decisions on best support packages. It doesn't replace our normal processes for safeguarding. It doesn't kind of replace any of that kind of processes around referring families in, around safeguarding concerns. It was primarily around that visibility. So the partners who are currently involved in kind of developing it and using it is our health colleagues, the local authority, we have schools that input in it, and we also have our early years settings from the private sector. The platform itself was co-designed by partners, as I said, in March. So we had very quickly mobilised a group of professionals across the partnership to kind of co-design what we wanted it to look like. And we're quite fortunate in Salford because we do have a team of developers who sit in our IT department who were able then to translate our thinking into some kind of into a technology platform to enable this process to take place. If we just move on to the next slide, please, Charlotte.
Can I just come in there, Becky?
You can, Geoff.
Just from an SEN perspective, so when just building on what Becky's shared with us, When schools, for example, and the first lockdown, when schools were doing welfare checks on children with SEN, particularly those with education, health and care plans when they weren't in school, and as Becky said, not reaching social care threshold, but through their twice weekly, roughly, check-ins with families, if there was any slight concern coming up, it's what they were doing with that information. So at the start, they were reporting that information in to local authority SEN teams, etc. But this was a driver for the development of the platform, actually, because we were receiving loads and loads of information about families that wasn't at a safeguarding level, but we needed to respond to. And at the same time, as children were at home with education, health and care plans, equally, for example, therapists were making contact with families to consider how they could deliver the provision in education, health and care plans, and they were also raising some lower level concerns. So we had health colleagues plus schools plus SEN teams all raising levels of welfare concern about families. So that was the information that was flooding about when we came together as that group of leaders to discuss with the developers, as Becky said. Thanks, Becky. I just wanted to put that in.
I'm just picking up on the chat as well in terms of NHS providers. Yeah, health were at the kind of around the table as well when we were designing this platform. So in terms of kind of NHS providers, input from our 0-19 service, as Geoff said, therapy services, speech language communication therapists, our CAMS colleagues were involved in it. So the platform it sits across a wide range of partners, and you know it's been growing and growing as kind of we've moved out of the kind of first lockdown into a tiered approach and then into a second lockdown. And I think what was fair to say as well, very quickly we spent some time around information governance arrangements. We did a data impact assessment and we put information sharing arrangements in place, which we've been fortunate to continue to use regardless now, because we built the kind of information governance around initially the legislation that had changed as a result of COVID, but then we continued to work on the information governance to allow us to continue beyond pandemic as well. So if the legislation does change back around information sharing, we've got that built into it. So just in terms of how we kind of look to assess the need, it feels very crude and it's not meant to feel that way, but we kind of use that red, amber, green kind of ragging system. And what we did is we asked professionals to start to kind of rate and look at the level of need against them categories in accordance really with the health needs, as Geoff said, the kind of medical needs as well, the social needs and things like around the welfare of that child as well. And I think that was a really important part of it, because we wanted to understand the kind of how families were feeling, how children were feeling, and what maybe kind of issues that were now becoming apparent for a family wouldn't normally have been there. So we used a system where all children received a welfare check, and whether that welfare check was done through a speech and language therapist, an occupational health therapist, a school, an early years setting, an early help worker, or somebody from the SEN team, we made sure that children were getting regular welfare checks in order then to make a kind of decision around what their level of need was. So that RAG rating initially kind of informed us then about which children we needed, or young person or family we needed to discuss at a multi-agency level, and how we could then kind of use the RAG rating to kind of inform a decision making and a package of support for that particular child or kind of family within there. So no, not every child. I'm just picking up on, Sue, that's a really interesting question. I'm going to pick up on the questions as we're going as well as it feeds in. So not every child was RAG rated, but every child was kind of considered. So we asked, for example, in schools, we asked schools to think about all the children who would normally be accessing school provision and whether or not there was any concerns around them any of them children at the time, and if there was, then they would be kind of rated at a particular level, and that would feed into the discussion. Does that answer your question, Sue? As we've kind of moved along a little bit more, more children have been identified and kind of RAG rated, or their level of need have been kind of identified, but they've de-escalated or escalated depending on the circumstances as well. So it is very dynamic, and it is updated, and it is used now as part of practice, but I'll go on to that in a minute. Geoff, is there anything else you want to say before I move on?
No, the only thing for me to add to Sue's question was that initially we did RAG rate every child and young person who had an education, health and care plan, because that was a key focus for us at that particular time during the first lockdown. But as time's moved on, it's broadened out, and also many of the EHC children are no longer RAG rated as they're back in school.
Thanks, Geoff. If we can just move on to the next slide. Yeah, so just to kind of, it does kind of lead into the dynamic risk register. Geoff, you might want to give a bit more of an update on that.
Yeah, sure. So I chair our multi-agency panel that holds our dynamic risk information. So it was feeding in particularly around those families that we were considering perhaps holding a community CETR for. So although they were likely to be either a child in need or child protection, so already have a social care status, that wasn't set in stone. So if concerns were being raised that were particularly around potential mental health related and perhaps being at risk of admission to a tier 4 bed, then that information would flow through to the appropriate senior level panel that was considering the dynamic risk register in terms of holding CETRs. So there was a direct link between those two processes.
Sounds amazing. Well done.
I was amazed how well I made it sound then.
Yeah, please can you tell me how you did it, because I want to do it.
What I've got on the next 3 slides is some screenshots. I would have loved to have shown you the actual the tool in itself, but because it's live, it's got live data in there. I couldn't kind of demo it in a way that we would have liked to have done. So what I've done is kind of taken some of the screenshots of what it looks like, and it is and I make it sound really simple, but in some ways it is a kind of really simple tool to use. So each professional who has access to this, so each organisation sets their own access requirements. So health have a policy around who accesses it and what their levels of accessibility are from a health perspective. Likewise then from a local authority perspective, and then we support schools to do it through our early help system as well. So it's very secure in terms of level of permission for accessing it. It's people have their own username and password, and then once you get into the actual platform, your kind of levels of permission and what you can see and what you can do are dependent on the level of your kind of profession within your own organisation. So this screen here is a kind of screenshot of what we call our dashboard. So this is our home screen, and this kind of really, in a very visual way, kind of tells you at a moment in time how many children, families are in the system, and what level of need then families or young people are within that kind of RAG rating kind of categories. And again, this has grown as we've kind of used it more and more. So it kind of enables you to view at a really quick level where some of the emerging concerns are and where you need to start focusing some of the discussions quite quickly. So you can see that, you know, there's at the moment, this snapshot is showing that, you know, there's 5,862 young people, children and young people in the system. And then out of that, there's 139 who are shielding. So we very quickly were able to get the information on shielding children within there and shielding families. So at a glance, we could see where, you know, we had families or children where, you know, we knew they might not be accessing provision because they were shielding. So from a kind of, you know, Geoff's perspective, and I kind of lead some of the work around SEN within the early years, we were very quickly able to see which early years children with an identified special educational need weren't able to attend a setting because they were shielding. So we could allocate resource from an area SENCO to do some intense kind of home visiting, secure home visiting and kind of contact with that family in a different way. And the way we use this dashboard is to try and help us make decisions around the cohorts of children or young people or families we might need to be discussing at any one time, or where we think we've got some, you know, if we can see things are changing in terms of that level of need. The bit at the bottom where it says triangulation, where it's got 54 within triangulation, that's the function we use to kind of feed particular children and families into what we call our triangulation meeting. And that is, in its broadest sense, our multidisciplinary team meetings in localities. And we have 4 localities where multidisciplinary team meetings happen. They're scheduled in the diary kind of twice a week, but then they can be kind of brought up much quicker as we see that triangulation discussion needing to happen. And it might be in one locality, you know, we have a multi-agency discussion around 12 children, because that's what the kind of dashboard is pushing through for us. Geoff, anything you want to add before I move on to the next screenshot?
No, that's fab, Becky, thank you.
And again, if you've got any questions, please just jump in. It's an informal session. I'm just throwing a lot of information at you, so I do apologise. So if you can move on for me, Charlotte, that'd be great. So then you can start to drill down into that. So you can, if you was to click on one of them kind of, you know, categories like the amber rating, you can start to drill down then into an overview of who them people are. So again, I've just done you a screenshot here, and what that does is show you, obviously it's linked back into our case management system, so we get a direct feed from our case management system in the local authority. What we've not cracked is a direct feed back into our health systems. And, you know, if anybody's got a solution around that, would be great. It'd be great to hear that. But what this does is kind of gives you then a snapshot of who the child is, the young person, obviously the date of birth, if they've got an EHCP in place, are they known to early help, what area of the city they are, and who else is involved with that particular child. And then it starts to show you then how that organisation has rated that particular child. So you can see as this test in here that we've got you know, a test child here where it sits in our north locality, not got an EHCP involvement, not known to early help, but is kind of rag rated from a health perspective at a green, but actually from a school's perspective and an early years settings perspective, there's not been a welfare check. They've been unable to do a welfare check. So we might not necessarily then do that as a kind of key priority, but the locality, when they have their MDT meeting, will maybe make a decision whether or not they have a conversation back with the school for them to go out and make sure they can do a welfare check on that particular child, because there may be some concerns that that child's not been seen for a period of time. So it kind of allows for a very quick decision making, and it allows us then to identify probably who's the best place to go and do some of that initial support with a particular child. Some of the kind of I've given you quite a simple kind of screenshot there. Some of them will be quite complex, and it could be that they're rag rated with red from more than one particular organisation or professional. And what we would do then is look at that again and triage that for a multi-agency decision and a discussion about, do we need to be doing something else for this particular child or family. People comfortable with moving on? Great. The next one is just, again, you can dig deeper then into that particular young person. So you could you can click on the young person and then it gives you individual details in terms of the attendance patterns for that child. That's linked to school attendance and early years setting attendance, so the number of percentage days they've been in, the number of days they've been in, if they've got a kind of, again, if they've been discussed a multi-agency discussion already, what the outcome of that was, if there's any concerns around social care. So it's a really detailed view then around that child or the family. You can also start to understand if they're linked to any other siblings, you know, what's going on for them siblings, you know, if they've got any other family members who may be involved with them. So it gives you a kind of real detailed understanding at an individual level. Youth offending do feed into it now. We're very early days with this, so from a youth offending perspective, but that started to happen, and we'd be really keen to kind of share, you know, what that looks like. But yeah, as I said, it's been growing and developing throughout the pandemic. Next slide, please. And I think I touched on this before. The purpose, what we wanted to do was kind of have that visibility of children in order then to have a kind of decision making and a discussion that is informed by practice and across the partnership. So what we have as a result of this is what we call our triangulation meetings, and they happen in each of the localities. So it is, you know, nothing different to what a lot of people already do. It's that multidisciplinary team meeting, but what we're able to do for them is have an agenda that's kind of developed from the Assure platform in preparation for their meetings. So the information's there before, so when we get to the meeting, we're having a very purposeful, focused discussion, knowing all the information. So each agency uses the Assure platform to kind of make a decision whether or not they want to push that child through, or that young person or family, for a multi-agency decision. So they can have the discussion, so they can have a look at who else is involved for the family, you know, what RAG rating different professionals have given that family, and then they can, as I said, make a decision whether or not a multi-agency discussion is needed. And the membership now of them multi-agency decision meeting teams has actually increased because of this particular platform. So we have early help locality managers there, the cluster leads, we have our schools coordinators who support our schools, we have youth service, as I said, now we've got youth offending who attend that now, we've got a direct feed into CAMS, so CAMS can't attend every meeting, but they have a direct link into the discussion, education, welfare, and yet GPs have been what GPs do, they can access the platform and they can input into the platform. But when we had conversations with our GPs at the initial onset, because of their capacity to manage that, they had a different route into the multidisciplinary team meetings. But in a nutshell, yeah, they can access it and they can input on it, but they feed into the discussion through what we call a welfare requirement, a welfare check. And that's how our GPs chose to access it. So the kind of the Assure platform gives the capability to have the discussion that's needed weekly in their multidisciplinary team meetings. I don't know if you want to add anything into that discussion, Geoff.
No, I don't think so, Becky. I think that's very, very clear. I think it's just that it's just that it's the partnership approach, isn't it? And I think it was giving initially, it certainly raised the confidence of partners to be able to put families forward for that triangulation discussion. But having been able to get that overview beforehand of other agencies' involvement and seeing if there were RAG rating concerns being raised. So I think that pre-knowledge before they came into the triangulation meeting is absolutely invaluable. I just think it helped to empower professionals before those discussions took place.
And we always say the same, and you can see it at the bottom, it doesn't replace any of our statutory CP conference meetings or our kind of team around a family kind of meetings. this just enables that multidisciplinary meeting at the level before it may get into that kind of arena. And as Geoff said, it provides such a great forum for multi-agency working at the heart of it, really, putting that family, young person, child at the centre. And just picking up on your point, Leslie, about the GPs, as much as the GPs don't use it in the way I've just described, they were absolutely instrumental in helping us develop it as well. And I think, you know, as we move out of the pandemic and you know, people's roles become more of what they may have used to be like, they might start to use it in a different way. It was just at the time and how things are, that then use it in a way that we currently use it just didn't lend itself to where they are currently. So the next slide, couple of slides really, is just to give, and I'm going to hand over to Geoff in a minute, just to give a kind of overview of how, I suppose, the impact it's had really, and how it's been used to help get some really good positive results for some children and young people. So I'll just pause there and just ask if anybody's got any questions at this point before we move on to kind of the impact bit. Okay. Oh, I can see a hand. Is it Sarah?
Yeah, hi there. Can you hear?
Yes. Hi.
So I'm interested how you know that the information is current. What's your sort of quality assurance around knowing it's current? So you could go on there and you know, I accept when all the information's on there, it's just perfect. It's what everybody wants. But there's two things. One is you might go on and be deceived because actually you have a quick look and actually the information that is the most relevant is not there. So that's one thing. And then the other thing that I think we experience with placing, I work in an acute trust. I'm a paediatrician, but I'm also the DMO.
Yeah.
You know, is once you put things on, whose responsibility to take them off again? It's all great. Everybody wants to put things on, but you've got to have somebody to take things off. So for me, it's that sort of quality assurance element that I'm interested in. Yeah.
Yeah, and I think you're absolutely spot on. And, you know, we did talk about this at the beginning when we set the platform up, because it is only as good as the people who are inputting and then keeping it updated. So we do have a terms of reference that sit around the platform and around the triangulation meeting, and within that is accountability. Now the accountability is, and this is where you kind of get into your kind of sign up from your organisations who are using it. So the accountability to kind of keep it updated and to keep it relevant sits within that each individual own organisation, but then that's monitored through the triangulation meetings, and it's also updated during the triangulation meetings as well. So we have a locality manager from an early help perspective who oversees the whole of the platform, and that particular role is responsible for liaising with all the strategic partners within the different organisations. And then at a kind of operational level, then they're responsible to make sure that they get their areas to keep it updated. And so far, Sarah, we haven't had an issue. The bit where we've slightly where we've had to put some additional support in is around our schools. So obviously, you know, we've not given access to the schools to use it because the data, the information sharing is and the kind of data sharing around that was really difficult. They keep it updated in terms of attendance, because that's a direct feed into what they currently do. But the way we keep it relevant and updated from a school's perspective is through our early help system. So we have schools coordinators who are linked to schools, and it's their responsibility then to keep it updated. But it's all that's all set out in our terms of reference and accountability around the application. I don't know if you want to add anything, Geoff, on that.
No, I think, you know, I think Sarah absolutely hits the nail on the head there, that it's only as good as the people that are using it. But I think it's the governance that you've alluded to in detail, Becky, that absolutely supports that, and it's the shared motivation of the partners who develop the tool because we all recognise that it, if it wasn't used appropriately, that it just wouldn't be of the value that we needed it to be.
And I think there is that. I mean, from a kind of, if I just think about our kind of colleagues in our health providers, so there's a lead who takes responsibility to kind of keep it updated from a kind of therapist perspective, and then there's a from the 0 to 19 service, there's a lead there, mostly at that kind of strategic level as well. Our kind of lead within CAMS, again, it's at that kind of strategic level. So there is that accountability is there through the governance, and that has been important, and we and which is why we've just updated the terms of reference. We review the terms of reference and the accountability every 6 weeks at the moment, to make sure we're still getting the right information we need, and it's relevant.
And just coming in again, Becky, bearing in mind Sarah's role, our DMO and DCO buy-in from the very beginning in the development of the app was absolutely critical. So particularly, we have a DMO and a DCO, so it was particularly our DCO that led on this. But having that from the send perspective, right from the very start, from a leadership point of view, was critical and ongoing as well.
And I meet with her every month as with a response to this as well. So we have a monthly check-in around the Assure platform and its relevance and how we're using it, and if we need to make some changes back within organisations, or pull together a governance meeting around some of that. So that's a really good point, that, Geoff. Any other questions at this point?
Just to let you know, everyone, we've got just under 10 minutes left of the session.
We're nearly through. Sorry, Charlotte. Geoff, can I hand over to you?
Yeah, sure, Becky. Yeah, could I have the next slide, Charlotte, please? Yeah, thanks. So I just thought we'd throw in some of the activity which is based on the themes that have come out of the app. So, what we've talked about is the individual cases, but what became apparent, and this is particularly pandemic related, but it's still relevant, in that we were starting to draw out some themes. And the very first theme that became apparent was that through the welfare checks of families and some of the risks being raised and recorded on the system, that it was that pure lack of access to outdoor activity for some of our most complex young people that was causing the most stress and pressure within the family home. Cast our minds back to the first lockdown, and all municipal playgrounds were closed, and it was really, really tricky. So what we did in response, and this was as a direct result of the information coming out of the app on a themed basis, that we commissioned a number of services to enable us to reopen and use in a safe way a community playground that was linked to one of our special schools. So we were able to open it up and using a different app through our Salford City Council website, get a booking system where families could book for an hour's time and leisure on a community playground. So it was individual access, and we commissioned an environmental deep clean in between each family visiting the playground. So it's basically 40 minutes in the playground and 20 minutes deep clean. And as it happened, there was also changing facilities annexed to the playground, so they included a deep clean there. And such a simple idea resulted in such fantastic outlet for some families that were really feeling the pressure at that time. And that's Joshua there in the picture. His family were absolutely keen that we could share, his delight as we sharing some of our experiences from this. So that was one example that we knew that leisure facilities was a real issue, but using that information and intelligence coming out from the app, we were able to respond and make an impact. Now, the other one was around our families that were not eligible for the other avenues of support that were around during the pandemic. So one great example of that is around, we know that there's been a checkered history as regards access to digital solutions for families, and there were the laptop schemes coming through from the DFE and different avenues of support. But as we know, there were many, many families that were not eligible for those avenues of support, maybe not in receipt of social care support through direct payments or individual budgets in that way. So what we were able to do, and we made a decision that actually through the app and the welfare checking was resulting in us really focusing in on what families needed during the lockdown. And this flowed over into the second lockdown as well, is that they just needed something to be able to provide some distraction. There wasn't going to be holidays or day trips, etc. So what we decided to do is to develop a very, very easy and straightforward route to obtaining an individual budget. And in order to do this, we used some of the COVID grant that the local authority received, and we managed to get an allocation of that. And we were able to translate that into the availability of up to 600 individual budgets at up to £500 each for individual families. And we focused on those families of children with complex needs who weren't open to social care, so didn't have any recourse to other avenues of financial support or welfare support, but who actually were really starting to feel the effects of the lockdown. So we were really doing a lot of work, and I'm sure other areas of the country are much further advanced than we were at the time, but we were really trying to fast forward pre the pandemic some of our work around personalisation and individual budgets that were spanning education, health and social care, so bringing together personal health budgets, direct payments and EHCP personal budgets. And we weren't quite there, and again, it's amazing what a pandemic makes you do very smartly. So very quickly we were able to do something around that and get a process and an audited process in place with an easy assessment procedure that enabled us to give payments to families to enable for them to be in control of their purchases and to buy things that they were interested in getting that supported the family and keeping them active, involved, and the children entertained. So as I say, we were able to get the money into accounts very, very quickly to the right families, been identified through the use of the app, and delivered those personal budgets. We've got proofs of purchase afterwards. Very, very fast turnaround, quite high intensity for 2 or 3 staff within the local authority to make it work. But that was actually, in terms of a process, very, very smart and worked really, really well. So we're really from assessment through to receiving money in the account was less than 10 days. And in terms of the lockdown, timeliness was absolutely essential. So again, we were able to target that to the right families. So again, that was just another example of a themed approach from the information and intelligence coming out of the app.
Charlotte, what are we like for time?
Just got about 2 minutes left.
Okay, I'll stop talking, but just to sum up, I think as Geoff said, really, one of the things we did is we were able to kind of target cohorts as well. So not just at an individual level, but we could look at cohorts of children, young people, or kind of cohorts of need through the application, and we continue to do that. So, you know, during the pandemic, we focus, as Geoff said, on some cohorts of support for our SEN children, SEND children. We did the same for SEND children within the early years as well. We looked at young people who hadn't been attending school, and to understand why them children hadn't been attending school. So we did an intense piece of work around that. And we also were able to kind of do some focus work on our under ones, because we knew under ones and parents who had babies during the pandemic were kind of really having concerns and were struggling. So the platform allows us to kind of target particular thematic issues or particular cohorts as well, so not just individuals. And the place where we're taking it now is we're using it around our neurodevelopment pathway. So it's managing our process and our discussions, our multi-agency triaging discussions around neurodevelopment, making sure that we're getting the referrals at the right time, but actually each organisation are getting the right referral at the right time. And we're seeing a reduction in inappropriate referrals to CAMS through the use of the triangulation, because we're getting the right families at the right point, and then able to use CAMS in the specialist way that is needed.
Yeah, so it's that ongoing use of the intelligence that's coming out from the app, you know, is informing our strategic development and strategic priorities, actually. So that's the ongoing use. I know we've talked a lot about what's happened during the pandemic, but it's the ongoing usage of that information.
So I think that's it from us, Charlotte. I don't know if you
Yeah.
want to.
Brilliant. Thank you so much for coming and giving your workshop. Daphne's popped in the chat for the session the evaluation for today, so everyone has time to click on that and fill that out before they leave. But this is the end of the day, so thank you again, Geoff and Rebecca, so much for your workshop.
Thank you. Thanks everyone for listening. Thanks Charlotte for your support.
Thank you.
Have a great weekend, everybody.